Congratulations, you and your baby have made it halfway through their first year of life. I am Dr. Nkirika. I am a pediatrician and pediatric ER, and I am a mom of three. At 6 months old, a lot of babies are literally interested in everything you put in your mouth. They're watching you from hand to your mouth. So if they're showing signs of readiness to feed, you can go ahead and start feeding. But we generally say that signs of readiness are when a baby is able to hold their head upright, they're able to sit in a high chair, they're able to put a food into their mouth and actually swallow and not push it out to you. Those are signs that they're ready to start trying out foods beyond breast milk and formula. As a pediatric ER doctor, one thing that I highly recommend to family when starting to move to baby foods is to have an antihistamine in the house because commonly some babies may break out an allergic reaction. This is not too scary by any chance, but I always want families to be prepared and prevent an ER visit that they do not necessarily need. Most babies are going to only have a rash if your child is darker skinned. You may want to look closely because it may not look as red, but most kids are going to have a rash that's a little bit itchy and generally resolves when you use things like antihistamines like cetirizine, loratadine. Remember, Benadryl is no longer recommended. At 6 months old, when you start introducing foods, you want to start small and start introducing one food at a time. This generally helps you to know what your baby is having an allergic reaction to or they're not tolerating compared to when you introduce multiple foods. And then you're not able to see what is actually causing their intolerance or the reaction. Another key to introducing foods at 6 months old is being patient. You will be surprised at the number of babies who are actually going to decline or refuse some foods because the flavors are all new to them. Some families may choose to start with mashed vegetables like peas or maybe fruits like bananas, but you may want to try them multiple times before saying your baby does not like it. Remember, your baby has been on liquids, breast milk, and formula for a certain period of time. So this is all new to them, so you have to give them time. What I've seen work for a couple of families is to actually add a little bit of breast milk to the mixes they're giving them. That way your baby might be able to still taste a little bit of the breast milk or the formula and the whole mix of the peas or the veggies or the mashed fruits that they're also getting accustomed. With starting solids and baby foods, don't be surprised when your baby starts getting constipated. Depending on what foods your baby or your family starts to give your baby, you may notice your baby's poop start to get more solid, start to space out more, and they may actually strain more when they're having a bowel movement. I have a whole nother video that differentiates your baby having dyschezia, which means pushing and trying to poop versus constipation. So you can watch it to be able to tell what your child exactly has, if it's constipation or just a regular infant dyschezia. With starting feeds as well at 6 months old, the one thing that every family wants to hear is now you can give your baby water. When they're younger than 6 months old, we don't recommend the water because they're still young and delicate. But once they're older than 6 months old, now you're introducing the solids and the baby food. We're getting constipated. You can also add water to your baby. Ask your regular doctor based on recommendations of how much volume to give a day. But now you can add water for your baby. When it comes to development, your baby might have their first tooth or they're drooling more or they're showing signs of cutting out their first tooth. Now, this is a whole range. A lot of babies may not develop any sign till 6 months old, and some babies may develop signs at 6 months old and have no tooth till about 12 months old. My first son, for instance, showed sign about 6 months old, but he actually did not get any tooth till 1 week before his first birthday, where he had 4 teeth come out at the same time. So remember, every baby is going to be different. You just have to know what the range is and have patience and follow them along. At 6 months old, some babies are now sitting comfortably without support, and some babies might still need a little bit of support to be able to sit comfortably alone. And some babies are actually working on movements that will lead them to crawling. So if your baby is sitting comfortably, you may notice them trying to go on all fours and they can rock back and forth because now they're making movements and trying to crawl. Most babies do not start crawling till about 7 to 8 months of age, but every baby is different. But you start noticing that range of like sitting, trying to crawl, or even crawling over the next couple of months. Fall safety is becoming so much more important now because you have a mover, a sitter, and a mover. So again, put them on the floor, put things around them, because when you leave them on the bed to sit or trying to roll, be close to them because it's not uncommon for babies to fall off the bed and sustain a head injury. In that same line, as a pediatric ear doctor, I have a full video on head injuries, how to treat them, how to treat goose egg bumps, when to be concerned about head injury. And I wanted to watch that here so you can know when to tell, when to get your child checked out on things that may be concerning for a severe head injury in babies and kids. The vocabulary of your 6-month-old is, of course, getting more exciting and overblowing. They are babbling with you, trying to have conversations with you, smiling at the same time. So this is when you want to continue to encourage a conversation. You may not hear nothing that they're saying, but continue to babble with them and have conversations with them. That's along the development of helping them talk and having development of their mind and whole conversation. Their curiosity knows no bounds at this age. This is when they're able to see toys, they're able to reach out, they're able to get things and put into their mouth. They're starting to explore with their hand-to-mouth behaviors, so they're more likely to put things into their mouth. This is when you want to make sure that things around them, there are no small items smaller than their mouth that can easily fit in their mouth, but this is when you want to make sure safety around them is getting improved. Strange anxiety may kick in now or kick in a little bit later. They are also recognizing familiar people around them. And when someone they don't know comes around them, they're actually going to get sad or start crying, so you can know they feel like they're in danger. Your baby at 6 months old is having a lot of personality changes, a lot of development going on. And at this age, a lot of them might have doubled their size. So you're going to have your next visit to your regular doctor at 6 months old, also when you have another vaccination. But we also do a weight check to make sure your baby is growing at their own curve or actually growing appropriately. Now that your baby is 6 months old, I want to hear from you how the first 6 months has been for both you and your baby. Has there been any differences with your baby and other children? Definitely, my babies were all different and I enjoyed every moment of it. But I want to hear from you how your baby's first 6 months has been and what other things happened at 6 months that I didn't mention in this video. And with that, thank you for watching. Don't forget to subscribe. All the subscriptions and likes and comments keep me going. And I will see you in the next video with your baby at 7 months old.